Warm greetings from Herghelia. Sorin Capra is my name, and I'm the head assistant at the Lifestyle Center. And today we will talk about an art, the healing art of massage. And if this is an art, there is also an artist, a great artist who created me and you and who distributed gifts to people. He gave me this gift too, and I love to share it with you. The art of massage is defined by systematic and scientific manipulation of the soft tissues. It is a procedure that can be applied manually or with devices. But art is done with a pen, with a brush, so the highest quality massage is done with a warm hand that transmits something from the soul. What are the actions of massage? We have local action and general action. Local action produces calming on the joint skin or muscle allergies. Whether these pains are traumatic or irritative, inflammatory type, it has a circulatory stimulating action with tissue nourishment, improving both lymphatic and blood circulation. Then again, an important depurative action of cleaning by mechanical effect. Stasis is removed from the interstitial tissue, even favoring the reabsorption of infiltrates, transsudates. Exudates, we call them in popular terms toxins. As a general action, it contributes to the increase of basal metabolism. The burn stimulating both respiratory and circulatory function, having a sedative effect. On the nervous system through the skin, that is a very well innervated and vascularized. When we talk about vascularity, a significant part of the amount of blood, about a quarter, is found in the skin. All this together with substances that are produced called stamens. After the massage, maneuvers like pinching, hitting, kneading have a very important role to produce vasodilation. In this way, the massage also produces peripheral hyperemia with revulsive effects much sought in therapy. Indications of massage: rheumatic diseases, orthopedic diseases, post-traumatic fractures. Dislocations also facilitates wound healing, neurological problems, paralysis, muscle atrophy. Vascular problems, varicose veins, chronic edema, in nutritional diseases, it is effective. Obesity, diabetes, relieves stress. How good is it that we have an element in these tense days that contributes to reducing stress, lowers muscle tension, and even blood pressure. And implicitly, anxiety prevents ulcers. This is again known in diabetic children, and it has been found that evening massage helps lower blood sugar levels. I used to massage my children many times, and every time they calmed down and had a much better night. My daughter is still asking me, "Daddy, come give me a little massage because I feel kind of tense." It has also been found that in asthmatic children, it improves lung function, thus decreasing asthma attacks, decreases the level of stress hormones, especially cortisol. There are also some contradictions, especially in acute skin diseases, inflammation, eczema, dermatitis, boils, acute infections of bones and joints such as arthritis, osteomyelitis, in vascular problems such as hemorrhagic syndrome, phlebitis, and cancer. We do not work on tumors because they can spread tumor cells. In acute pulmonary tuberculosis, digestive problems, and hernia, to perform this healing art of massage as accurately as possible, it takes a few principles. First of all, the care of the hands. Nails to be clean, to be cut short, and the hands to be warm when we place them on the patient. Then the posture is essential for the massage therapist in order to avoid fatigue and back pain. The back should be kept as straight as possible and working from the knees. We bend the knees when we need to get closer to the patient. A big secret in this art, a good operator applies body weight instead of muscle strength. Many patients, when they see me of a short stature, are wondering what kind of massage this gentleman can do. But the secret is not in the physical strength, in the muscles, but in the control of the body weight. And in this manner, a very good massage is done. Then the patient's position is important. They should feel comfortable and be able to sit as comfortably as possible. The massage table. It is important to be positioned properly. How do we get positioned? Depending on the height of the therapist, we extend the arm next to the body and touch the table with our fingertips. This way, it is positioned where it should be. Then comes the height of the patient. This way, we can work from our body weight, as we just said. Environment is also important to be kept clean, neat looking. If we have a musical background, it is even better. It contributes to extra relaxation. The massage oil we use can be a vegetable oil and oil with certain essential oils. This one is with coconut. It does not have to be a mineral oil. It is best to use vegetable oil. This will not irritate the skin. Then the personal appearance is also important for the massage therapist. Clothes to be clean and professional looking. Impeccable personal hygiene means that girls have tight hair. Boys have short haircuts. Patient coverage is important. And one more essential thing in this art is to leave only the portion we massage exposed. The rest of the portions are to be kept warm, giving additional privacy to the patient. Pressure and pace are important. We need to know from the beginning what we want to perform. If we do a relaxation massage, then the pace will be slower, with a pressure not too low but not too high. If we want a stimulating massage, to put that person on their feet, then the rhythm will obviously be faster. And the pressure will be moderate. If we do the massage to correct certain situations, the so-called therapeutic massage, then rhythm will be medium and the pressure sometimes soft, sometimes slow, sometimes strong, depending on the area we massage and the problems we discover there. And one very important thing again, do not lift the hands off the patient. We turn around the table. And always try to keep a hand there. In this way, we give the feeling of continuity. If I raise my hand, it's like I finished the massage. Also, another important thing is the patient's feedback. We have to ask him how he feels. If the rhythm is good, if the pressure too hard, or he wants me to press a little harder, this communication with the patient is important. The purpose of massage, as I said in the beginning, is for relaxation, correction, or therapy. Obviously, it is also used in the sports field. Today, we will do a relaxation massage called full body massage or general massage. We will focus on the back of the body, and on the front, we will work only on the arms. We will invite the patient. We invite a young person who will benefit from this massage. And we'll explain what this procedure consists of, and then we will start this art. An important accessory on the table is a pillow that we place under the patient's feet. It is important that the nails and fingers are not pressed against the table, because this will create discomfort. We have the patient, Christy. Christy, I'm going to give you a relaxing massage. The position as you sat down is good. We covered him. Yes, here we have the towel that we want to use if it is chilly. We can also use a blanket. Before performing the massage, we will wash our hands. To ensure the patient that our hands are washed, even though I've washed them before, he doesn't know it. He hasn't seen me. We wash our hands well. We also use a solution at the end with alcohol for disinfection. We have him ready now. But before we start the massage, our habit at Herghelia is to invite the great artist. To help us with that, we will do. So I'm going to say a prayer for Christy. Christy, can I pray for you? Yes, thanks. Thank you, Heavenly Father, for this day you have given us. Thank you for your health. Thank you for this occasion when I can be of use to Christy. Help me as a therapist. Help him as a patient to feel well. Bless the people who will see this material. Please help them to be helped. As much as possible through this massage. And we thank you. And we ask a blessing in the name of the Father, the Son, and their Holy Spirit. Amen. We will uncover only the part we work, respectively the back side of the leg. For this, we will insert a portion of the sheet under the underwear so as not to stain it with oil. We position the foot well, and we start with the application of the oil. We apply oil on our hands only, not directly on the patient. In this way, we also warm our hands. And now we apply it. It's still not enough. When we work with men, it takes a little more oil. Oil is better than talcum. Talcum powder can produce carcinogens. I recommend massage oils. For the past 24 years, I have been working only with oil at the Herghelia Center. I applied the oil, and now comes the art. It's like poetry. It has a beginning, content, and an ending. The beginning of the art of massage is called effleurage. We start the plantar area and go all over the leg with the effleurage. It's also called Contour Effleurage. Look at my position. I need to move at some point, and I move by bending my front leg. So I keep one foot in front and one foot in the back, so I work from the body weight. Exactly what I was saying at the beginning. Then the form of a tree. The first time the pressure is softer, then it can be a little deeper. We decided that the rhythm would be for a relaxing massage. We got warmed up. We got acquainted. It is something important when you touch the patient. The touch is very important. Hands and fingers to be there, also our whole palm. All parts of the fingers should be there so that the fingers are not raised. Only the palm. It is important that this touch conveys a lot of security. I warmed up. So we cover the part we work on and focus on the plantar part of the foot. Here we will perform an effleurage. Palm Effleurage. Then comes the friction. This is already part of our palm friction story or art. Then friction with the fist. We can help with our hand. The other one, let's enter it below. Next is thumb friction, or friction with the thumbs. We divide the sole of the foot into 3 parts. Friction is always something either round, a clockwise direction, or a counterclockwise direction, okay? So one finger goes clockwise and the other counterclockwise and alternate. Understand? A little slower to see the movement. Learning this is not so hard. Can you see this? This is the movement. It's called thumb friction. We also have a friction that is on the heel. It is called stationary thumb friction. Why this movement? Because the skin is much thicker here. Now we will work on the ankle as well. As much as possible, an important element that we must keep in mind is the Achilles tendon, the strongest tendon in the body, and it has to be worked well, working next to it with friction, with the thumbs and with traction. We have another method called cross fiber friction. Here with the thumb from other areas, you will see the palm. Yes. Here with the thumb from other areas, you will see the palm again. And now we move to the next part of the leg. The leg area, the legs are where we have gastrocnemius, the twins as we say, the soleus, important muscles that we have to work. First time effleurage, let's not do the same effleurage that we did at the beginning. Contour Effleurage. We do an alternating effleurage with the palm or the crest of the fingers. We can do both. Always, even when in the beginning, we warmed up by effleurage. When we reach a certain portion that we are going to massage, we start again with effleurage. Then comes palm friction. Many times I'll repeat this friction with the palm of my hand. Clockwise. Do not make large jumps and circles. Rather punctual or small circles. This way you can catch any area with your hand. Again, an essential thing in massage a masseur has no left hand. The masseur has 2 right hands, which means he has to work in the same way with his right hand and left hand. Do not forget to use the pressure of the body weight and not the hands. This is what we should do. The right hand joint is not bent if we have the table properly positioned. With palm friction, cresting friction is next. We bend our fingers. We bend them. The friction is still round. Don't forget. The front part of the place where I work was done with my right hand. The outside with the left hand, and the thumb is there for support. You understand? It helps me with support. Cresting friction is followed also by thumb friction. We divide the configuration of the leg into 3 or 4 parts. It is essential to pass each area carefully at least 2 to 3 times. And don't forget to go round and round. And now comes cross fiber friction, pressing both downward and upward. It's called peeling. It's like peeling skin off a fruit, but from the body. Do not forget my hands remain stretched. Bend the knee or knees as needed. Very good. Now we bend the foot at 90 degrees. And we will work the toes a little. We will work them with a finger friction. Each toe as much as we can. The foot massage is supposed to be done on the frontal part of the foot. But now we will get satisfied only with the back part. We will also do a mobilization of each toe. Understand? Rotations and tractions. We are now working on the intertarsal area. Well said. Also a friction. Here we cannot do a round friction, but rather we will do a more alternating and linear friction. We work in the ankle area where we could not work on the other side, and now we will do a flexation of the foot and an extension. So we will bring the foot towards the thigh. We will bend the leg on the thigh, and with my forearm, I will press the foot holding the palm on the heel. And then this way we produce a good flexation. And then we bring the foot down and we will extend it. Don't forget about your body weight. You will get bored of this aspect, but it is still very important. After doing flexation and extension, we will do a mobilization of the left ankle rotation and right ankle rotation. Okay, somewhere in the Achilles tendon area, we will hold one hand under the foot. Very good. We'll move on to the next leg. Hamstrings. Here again we have important muscles. The bicep femoris. We work an alternating effleurage with alternating palms and with the crest of the fingers. And again, we start or continue with palm friction. using round, okay, on both sides, and first one, then the other, using both hands, and then with the ridge of the fingers. Is it okay, Christy? Or is it too hard? No? It's all right. Next with the thumbs. We use thumb friction. You can repeat this a few times. And now coming up is a cross fiber or a peeling. We go over the muscles, we go down, then we come back, then we move up higher and higher. We finish this part, we make a Contour Effleurage, and next a Petrissage or a Kneading. Very important, this method. Under the action of this method are developed those substances that we talked about at the beginning. Histamines that produce vasodilation or hyperemia, and hence a state of well-being that brings healing. It also squeezes the lactic acid out of the muscle. You will see this method done again in the back. And coming up next is the tapping. Tapping and hitting, also on the plantar side. All three methods I did on the dorsal decubitus. Now with the palm, and then with the fist. We are about at the end of the story at the foot. We will end with vibrations. They are very important. The skin is well vascularized and innervated. The nerve endings we stimulate with will reach the central nervous system, which in turn will act on the whole body. Before we do tractions, we will also do a mobilization. With an effleurage in the popliteal area, hear carefully, very carefully. We have blood vessels and nerves, so you want to make sure you do it very carefully. And the last phase, the shaking. Christy's feet are ready. Of course, then you will continue with the other leg. Moving onto the other side of the table, but you will do that yourself. Next, we will do the back. So we finished both legs on the back side. Now we'll take care of the back. We will prepare the patient for this. Insert a portion of sheet under the underwear and then fold the sheet. Apply the oil. Do not forget to apply on our hand and somewhere above the sheet. Do not drip. It's a very unpleasant sensation if the oil will drip on the patient. He will be startled, and everything we have obtained, the relaxation that we wish to achieve, can be ruined with a drop of oil randomly fallen. It is good to avoid such situations. Apply as much oil as needed. Do not apply too much, so that the hands do not slip too much. We don't apply too little because we can't work. I applied the oil. Now follows the beginning of the story or art of the bilateral effleurage.
On the paravertebral, on the shoulders and back, always when we go up, use higher pressure. When we come back down, use lower pressure. Look at how I move around the patient. It's kind of a dance that we do, okay? I bend my knee, but my body weight is there. Or better said, my body position is there, where my hands are. In this way, I will apply pressure from the body. Don't forget your hands need to be there. I was saying, how important is the touch? To be there with every particle of our hands, okay? About 10 times. Then a tree-like effleurage. I used to say that massage is an art. So we draw the branches, 2, 3, 4, and return with a light effleurage again with 1, 2, and 3, and 4. We consider that we have warmed the back, or if it is not warm enough, we make another effleurage. In the form of a ring, we have warmed the back enough, we cover the part we are not working on, and we focus on the gluteal area. Here we have a small portion in the sacral area. And we'll perform a thumb friction massage in the area of the sacral bone. We didn't move much. In practice, we uncover the patient a little more. Now we haven't uncovered him very much to protect the privacy. Then follows a cross fiber. A passage over the muscles with a few fingers. The same on the other side. So a friction with the thumbs and a cross fiber. And we have another maneuver here. A saw. How is it, Christy? Is it good? Let's have a sacroiliac pressure on both sides. For about 10 seconds, we feel some holes there, like that. We press for 10 seconds. We continue with the gluteal area, the buttocks. We apply the oil. A heating alternating effleurage. Next, the content. Palm friction. Friction with the fist. Here we have generous muscles. Do this from a distance. Or we can go to the other side. We do some kind of kneading, but it's still friction. This maneuver is very good. Don't forget, we are working from the body pressure. And now with the fingers. Thumb friction. Thumb rubbing in a ray. Over the buttocks. Gluteus minimus, medius, and maximus. And there follows cross fiber, crossing the muscles. This transition is very important, both when we go down and when we go back up, if we get used to it. After we get used, we can make a transition over the muscles with vibration, especially when we go back This movement is even more efficient. When we go back, yes, the movement jerks. Good. We'll do the same on the other side. We'll move on to the lumbar area. We uncover the surface we are working on and wrap with what we have worked. In this way, we keep the warmth. At the same time, the intimacy. We apply the oil again, and even if we applied it at the beginning, it was absorbed into the skin. It is a good oil that protects the skin. It's not a problem. And now we heat this area with what maneuvers? Two maneuvers. Either through a rhombus. We draw a rhombus. I said it's an art. We take the pen and draw a rhombus. Or we draw an 8. Figure 8. In fact, what we are looking for with this maneuver, to warm up this area and follow the muscle configuration. We refer in particular to the lumbar square. We are warmed up, and now we're going to perform a friction with all our fingers. We are going to start with the iliac spine. Here the lumbar square is inserted. Then we will feel it under our fingers somewhere, near the spine, and we will pass by close to it. We will feel somewhere the C12 rib, the immobile rib. Be careful not to press hard and cause trouble. Christy, is it okay? Yes, it isn't too hard. Isn't too soft. Is it good? Do you feel relaxed? Is the position also good? Yes, good. This movement is very important. With all the fingers, friction, round, 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 round. Counterclockwise or clockwise. Depends on which side we're on. Now follows the thumb friction, or rather cross fiber. Friction with the thumbs on the lumbar square muscles. We also press when we go down, but from the body, not only from the hand and when we turn back, with one hand and the other. This way we do not get tired. Usually if I go up and work on the right side, I will work on with the left hand, and when I go down, I will work with my right hand. Then we repeat the same thing on the other side, and after I worked both sides, follows another friction, called alternation, with the palm, again from the body. To do this, we have to do the lunges on one leg and the other. We finish the lumbar area, we cover it, and now we reveal only a part of the back that we will work on. For this, we need the towel that we prepared beforehand. We will apply the oil again. You can't paint without oil. We work in oil, and there are other kinds of paintings, but we said that this is an art, is more special. It is a healing art, and we applied oil. We perform an alternating effleurage with the palm. With the ridge of the fingers. After introduction follows the content. Palm friction. Don't forget the first time. The first section is with the palm, especially focusing with the palm, and here we will work paravertebral. The vertebral muscles, and again using the weight of the body, you can see how I bend with each rotational movement. I lean forward from the body. That means my front leg is bending too. So I have one leg in front, one in the back, and it bends at every leading motion. And in this way, my back is as straight as possible. So I work from the body and not from the hands. The hand, as you can see, is outstretched, not bent. Cresting friction follows on paravertebral. For support, we can keep the thumb on the other side. Do not keep it in the air. It's harder, but we hold on to the opposite side. We don't press on the column. The massage is not done on bony prominences. It is performed only on soft tissues, skin, muscles. Good. After we've done palm friction on the paravertebrals, we'll continue with a friction with both palms. We call this maneuver the kitten. It is very liked by the patient, yes. So one hand clockwise and with the other hand counterclockwise, we can couple them both, but alternatively. We focus again on the bridge of the palm and go up and return with slight effleurage. Again, we continue. It's a very beneficial maneuver. Is it okay, Christy? Everything is all right. This is our kitten. Also, from the category of friction, follows friction with all fingers, called the 10 little soldiers. We try to get all our fingers involved in where? In the ditch next to the spine. Imagine going into a ditch and coming out on the other side. It's like cleaning. Okay? We position our fingers diagonal, and the same here. We try from the body weight. Is it okay, Christy? Are you sleepy? Good. It means that the substances that need to appear and relax you are working. Endorphins appear that will create well-being, usually appearing at the end of the massage, but can also occur during the massage, so we go up with this movement 3 or 4 times, cleaning next to the ditch, not the column, but next to the column. We go up to the occiput, and then we turn with our fingers 2 and 3 in the shape of a V just to bypass the column. We put the other hand on the palm, on the back of the hand, and we will make a turn or an effleurage. More pressure. So again, to show you better, I climb section by section. Please do not jump. We don't skip sections, and we don't take our hands off. You notice that I don't lift my hand from the patient. And then we turn, yes, and now follows the part next to the spine. A little further, paravertebral. We call this maneuver cross fiber on the paravertebrals. Very good movement. Up to the shoulder, and we go down with a hand. A maneuver called peeling, as if we were peeling a banana. You can see right away I'm going upward, cross fiber on the paravertebrals. And now I turn with my right hand. If I am positioned on my right shoulder on the infraspinatus or the latissimus dorsa, the great dorsal, once again to see the maneuver. Next comes the intervertebral space, the ribs, a rake-shaped effleurage. And then a rake-shaped friction. We have to feel it under our hand. How are they positioned? Oblique to the column. Here I am showing you something more complex. A more complex movement at the same time I perform an effleurage. So this hand goes down and makes an effleurage. And with the other hand a friction, drawing something around between my fingers. And of course I'm looking for spaces between Christie's ribs. I also finish the ribs. Next onto the shoulder blade. I have to go back. Did you see when I came back? I repeat this. It's another very important thing. So I worked and next I have to go to a shoulder blade. To work on the shoulder blade, I have to get to the other side. I do not lift my hand from the patient, okay? I return, but the hand remains there, as I said, the introduction. What are we doing here? A thumb friction. Thumb friction next to the wings, so to speak. Next to the shoulder blade. Friction all the way up then. We go back to the other side. If we don't know and don't feel the wing, we can delimit it by placing our hand on the back, and then it delimits itself very well. Can you see how well it stood out? Anyway, after we perform this movement, we raise the hand to the back and our palm under the shoulder, elbow as low as possible. In this way, we highlight the shoulder blade as much as possible. We do an effleurage in the first phase with the thumb, but also with the index finger. Again, an extraordinarily well-received and appreciated movement by the patient. Is it good, Christy? So go with your thumb. Up, up, and up. And now with all the fingers, friction next unto the shoulder blade. With all the fingers. And now we will try to pull the wing. From time to time, we catch it and traction it. Everything we do practically, everyone should do naturally if they make enough movement. And now a mobilization. Reverse rotations, tractions, shaking. Good. Let's move on to the other side. We will not present it anymore. The way we worked, one side we will work the other as well. After finishing both sides, we continue with the Petrissage, or with the kneading. In order to knead, we will wipe off all the excess oil from both our hands and Christie's back. There will be again a very important method of kneading, of squeezing. Here I want to explain more in detail as I show. We catch the crease. It's called Rusian Petrissage. We catch the fold and don't leave it up. We catch the fold and don't leave it up. We divide the back in two in this case. If it was a bigger back, we would divide it in three. Divide it in two. The first time we work on the side. Catch the crease and bring it up. Then we return slightly with an effleurage to catch another crease. We've already come to the middle of the back and we're taking it up again. One more time. We squeeze. We squeeze the tissues. We cross to the other side. So don't forget your hand stays there, okay? Again, we take the crease and carry it up. It's a squeeze. What should I call it? It's an artwork. But now we're working with dough. And we take the dough as the housewives once did and process it. Right? So we do with Christy's back. We take a piece of dough and bring it up to see what pretzel will come out in the end. Good. After Petrissage follows tapping. The three types of tapping: hacking, cupping, pincement, beating, tapping. Caution, we do not tap the kidneys. Let's jump over the tapping with the cuticle part. Don't hold your hands as for karate. Keep them relaxed. You have to hear the sound. I first started learning tapping not on the pavement but on bed and pillows. That's how you can learn. Then tapping with the ladle. The thumbs is stuck to the forefinger and the hand is in the shape of a cup. And that's where the air is to come out. Again, it creates a sound, a certain sound. If your palm is too outstretched, then it sounds. It's not correct. The sound must be closed. Another tap with the fist. Again, it is not with clenched fists. We don't want to hurt. But we want to do a good with a half fist and alternate. Next follows an effleurage. We are now approaching the end of the story for this part. Okay? We'll perform a vibration, and this can be learned as well, or in the beginning you can do a light touch. We are covering the back. Next comes a maneuver that I learned from a colleague. It's called bear stepping. It's worth doing. This maneuver is also very good. Look, the bear walks on Christy's back. Good. We now have another portion. The neck, scruff, and the scalpel. We need to work on them as well. Applying oil again. Where? On our hand. And there we'll perform another effleurage. We start the story again from the beginning. A prayer type of effleurage, together with our hands as for prayer. We spread our little fingers and go from one side of the column to the other by the ribs. Then we climb towards the shoulder blade, shoulders and turning back to the cervical area. Now we will tie immediately. This effleurage is very good. Yes, don't forget the position. We do everything from the body, not from the hands. Look how beautiful. After we do these effleurages, we will work on one side also with an effleurage. on the neck up to the shoulders, after which we will perform a friction with the palm in the shape of the letter C, enlarging the lateral sides of the vertebra as much as possible. In the same place of the opposite side, we have to work both sides because otherwise we fail to explain everything we want. Friction. This apparent effleurage is also a part of the friction. A friction with the first from the nape of the neck to the shoulders. Then we will work the upper trapezoid a little by maneuvering over the muscles. Cross fiber. Supraspinatus. And the shoulder blade razor. We do it again on the other side. So the upper trapezius, the supraspinatus, and the shoulder blade razor. Here we will make another cross fiber. Above the occiput to the shoulder and the petrissage with 3 fingers. We don't have enough space to use the whole hand, but we have and can use a few fingers. 3, 4, as many as you can, okay? In the same way we take the dough. And now we're going to make a bagel. Early made a pretzel, a baguette. Something will come out. We continue with the occipital area. We use all our fingers. We look at the occiput bone and we go past it with friction, round from the base, to the side of the mastoid area, where we stop. We don't go any further. There are important arteries. Cardioids. We don't want to disturb them. And thumb stationary friction. So we stop from place to place and press and cross fiber friction. Also, this occipital area, patients really appreciate these movements because if they are stressed, if they are tired, if they have worked hard at the office, massage in this area of the neck produces muscle relaxation and decreases nervous tension. They feel very, very good. Then comes the scalp. We try to take into account the structures of the scalp, the occipital, temporal, and frontal parietal. Compressions with the palm of the hand, and that maneuver the hairdressers, older barbers, sometimes do. A little head massage after finishing the haircut. Quickly, just like that. And now we cover the patient completely. We continue with the hand and arm. We apply oil on our hand. This aspect is very important. To not ruin everything we've worked on so far. With a drop of oil, we can ruin the beautiful canvas that has taken shape, the beautiful drawing we have made so far. Applying the oil, after applying the oil, we will perform an effleurage. Yes, again with the introduction. caressing with one hand and with the other while we hold the patient's hand with one hand and we'll warm it well. We can also put our hand down, make an alternating effleurage. One hand tries the other. Good. We cover the part that we do not work and focus on the fingers. We take each finger separately and we work it. Fractioning all the fingers. After we have done the friction in each phalanx, then we mobilize them. Flexion, extension, and rotation, traction. Let's take the next finger. Traction again, friction, mobilization of each phalanx. Flexion, extension, flexion, extension. Rotation and traction. Flexion, extension, and we have the thumb. We continue with the metacarpal spaces. Also a longitudinal and circular friction as much as possible. Now we turn the hand in supination. We'll do an effleurage on the palm and besides the thumb as well. Warm up followed by friction. To do this, we insert our fingers between the patient's fingers. And work almost every part of the palm. Yes, the wrist friction. We place the forearm down and warm it up. If we feel the need for a little more oil, we apply a little more oil. And alternating effleurage does not hurt either. Helps and follows the same maneuver. Palm friction. Friction with the palm. Round, we focus a lot on the palm of the hand. Friction with the ridge of the fingers. We bend the fingers and work with the ridges. And we work here again from the body. Yes, we bend down. Friction with the thumbs follows when we work with the thumbs. We actually feel the problems. We can find tense areas and we stop there. So this maneuver is the most meticulous and important. All the maneuvers are important, but with this maneuver, we discover where we have to insist more. A good massage therapist has his eyes in his fingertips. Of course, this doesn't happen from the first massages, probably after seeing this massage. When you are trying to perform it on your loved ones, you will work mechanically in the beginning. Don't worry, that's how I worked. But in time you will gain experience and your eyes will be there. Many people with vision problems can perform massages because they don't need to see. They need to feel, and this sense develops much more after losing the eyesight, or in case it is congenital. This is followed by cross-fiber friction or peeling. We turn the forearm upside down. We warm each time. After we warm up, or introduction, follows the content of friction with the palm, with the ridge of the fingers. Thumb friction. And then the last is cross fiber. Next is the arm. In order for us to be able to work, we will place it somewhere above the head on the table. I raise the head to make Christy more comfortable. If the table can't be raised, we can put a pillow. We apply the oil and I perform an alternating effleurage with the palm. Or with the ridge of the fingers, then the same maneuver with the palm. Friction with the palm, friction with the ridge of the fingers, friction with the thumbs. Remember to work from the body and not from the hands. You should not be too tired after doing 3-4 massages. If we work properly, maintain a good body posture, and work from the weight of the body, we will not get tired. Cross fiber friction, then position his hand over the chest and move on to the other side. Palm friction here. Here we have some serious muscles, the deltoid. We have to work hard. Thumb friction. Thumbs are the massage therapist's eyes. Christy being young, I didn't find stasis. I didn't find tense portions. He's relaxed. He's young, he moves, he eats healthy. But he also has time to tighten up. Cross fiber, friction, or peeling. And now a maneuver for the whole arm called a bracelet. As if I was putting a bracelet on his forearm. On his arm. Good. Then comes the squeezing, the Petrissage, the kneading. What we're doing now, we made pretzels, we made chopsticks. Now we are kneading the polenta. We made a good polenta, the dorsal part, the anterior part. Of course, the indispensable tapping is also part of the content of our story. If we can do all methods is good. If not, at least some of them. The final part of the story follows. Vibration. Caressing is easier. What we have stimulated so far is now going to relax. We are going back to where we left off. Easy mobilization. Shoulder rotation. We keep it under the elbow and a bit of passive physiotherapy. Because he does active physiotherapy as much as possible. Other patients cannot raise their hands in this way. We can help a lot. Performing the rotational movement with vibrations. And covering up to keep the warmth. I finished the part of the massage I wanted to present to you. Of course, you can continue with the massage of the face, chest, abdomen, but this is part of a specialized massage. Don't forget that we create a canvas, and an artist always puts something extra on each painting. Puts a little green, a little yellow. Even if apparently the paintings resemble, they still look different. So I encourage you, and I encourage myself, that each massage we do is a little different from the other. Not a monotonous one. It is an essential thing not to forget if the great artist is our creator, then we must keep in mind the thought that he is the one who heals us, and that is why we use these natural methods. And massage is one of the most beneficial methods for the body. But God also brings healing. May he be with each one of us. Thank you. I wish you all the best, and we look forward to seeing you. If you have an opportunity, I invite you to come and benefit from a quality massage at the Herghelia Health Center. Of course, experience has its say. Here we have favorable conditions. Besides the massage, there are other treatments and hydrotherapeutics, herbal baths, hydromassage, alternating fomentations that help a lot, paraffin, gymnastics in the pool, gymnastics in the gym, outdoor walks in nature, saunas, alternating foot baths, sitz baths, and face, aerosols, face sauna. All these treatments are at your disposal regarding the health conditions you come with. You can come here if you have diabetes, if you have nutrition problems, obesity, cardiovascular disease, hypertension, or other problems. If you have rheumatic problems, or simply you want to rest, you want to relax, you want to spend 11 days in a beautiful natural setting, in peace, tranquility, and with these natural treatments in which God is involved, you will truly benefit from. We look forward to seeing you at Herghelia in a beautiful natural setting with a healthy diet. A diet that makes you feel good. A diet that helps you lower your lab tests. You will leave with lower cholesterol, triglycerides, and uric acid, and a total well-being, different from the way you came. We wish you all the best and look forward to seeing you.
Hey, thanks for watching this presentation. My name is Bill, and I'm the voice behind this video. If you've not already subscribed to our channel, please do so by hitting the subscribe button. You'll get a notification bell every time we upload a new video. And if it's not too difficult, give us a like as well. This ensures that we'll keep being able to bring you great content and you'll get to hear me more. Leaving comments is also appreciated, and it helps us to know if we're meeting your educational needs.